I am illegal in this country. My parents are illegal here in this country. And when we were fleeing that situation, never at one time did my family say, let's look at which state has the greatest welfare and which state has the greatest benefits, because that's the state we're going to go to. Nobody leaves their country unless they have to leave that country. So when you're thinking about voting no on this bill, you're voting no against someone like me who has paid more into this country than it has ever given to me. That the blood of my grandfather who died for democracy, that he never received benefits being in this country, and yet he paid taxes his entire life into it. That my parents who have worked as entrepreneurs and small business owners and people who have paid into a system, that right now my father is refusing to get the surgery that could save his life because he's afraid of the cost and the burden that might leave my mother. That we are the people that you are calling illegal, the people who are coming here in ways that we broke the law to get here, when we're calling people who are undeserving. I am that person. My parents are those people. And this country will never be able to pay back what my parents did because they raised 4 engineers and 2 daughters in finance. And that we have paid more into taxes, we've given more to this community, more in philanthropy, more in what we've done, that this country will ever give back to us.
Representative Backer, I'm wondering in this bill, what in this bill would help lower the cost of health insurance for Minnesota citizens?
Representative Backer.
Thank you, Representative, for that question. Well, if we go back and look at the numbers in the February forecast, the government, Minnesota government, estimated about 5,500 individuals for the first year would be signed up for this program. April 24th numbers has over 20,000 individuals that have already signed for that program. When you do the math, what that means over the next 4 years, the next 2 biennium, that would cost Minnesotans roughly $611 million to provide that type of care and so forth. Our Healthcare Access Fund does not have that money. So what does that mean? That means we would have to look at other ways to get that money. Government does that by taxing individuals, okay? Could be taxing the plans, could be taxing something else. So when you have a program like California and Illinois saw that's out of control, that is irresponsible for us as members not to say, hey, we can't go down that track because it's going to go off the cliff. We keep going down that track, then we're not going to be able to provide care for Minnesotans who qualify for MinnesotaCare between that 138 to 200% level above poverty. So that means those individuals would have to take money out of their pocket. So this is one expensive program, and I appreciate that question. Thank you.
Representative Greenman.
Thank you, Madam Speaker. I heard a lot of words, but I actually didn't hear a single thing that would lower the cost of health insurance for Minnesotans. I want to come back to those Minnesotans you talked about who are relying on Medicaid and what that's going to do when the federal government takes that away. But right now I want to focus here on Minnesota. So let me make it more specific. So I heard my colleague talk about a 22-year-old non-citizen who's managing diabetes care. I'm wondering for that 22-year-old who their neighbor, maybe, happens to be a citizen who is managing diabetes care. What will this bill do for that 22-year-old to lower their costs of care?
Are you asking Representative Backer to continue to yield?
Thank you, Madam Speaker, I am.
Representative Backer will yield. Representative Greenman.
Thank you, Madam Speaker. I will repeat my question. Appreciate the procedure. Representative Backer, we heard, I think Representative Finke talked about a 22-year-old non-citizen who is relying on MinnesotaCare for insurance, and I heard somebody say, well, they can just buy private insurance. So I guess I'd ask their neighbor, a 22-year-old citizen who relies on private insurance for their diabetes care, what will this bill do to lower their costs of care?
Representative Backer.
Thank you. Good question. You know, the claim that people will lose health care that we've heard is not true. We have several mechanisms that individuals in Minnesota will still continue to get health care. Of course, ER. Now, I'm not disagreeing that's the most expensive health care. We also invested $40 million, thanks to Chair Bierman, in FQHCs. Also, along with that, we got community health care centers. And FQCs are already there for preventative care. We also have sliding scale services, and Minnesota's also have other forms of charity care. So there are avenues. What our side is advocating is that this is a personal choice, not something government should be doing.
Representative Greenman.
Thank you, Madam Speaker. Would Representative Backer continue to yield for question?
Representative Backer will continue to yield. Representative Greenman.
Thank you, Madam Speaker. So I heard the floor leader Niska say what this is really about, and the reason that he urged your colleagues to vote no against Representative Sensor-Mears' amendment is that these are the most expensive ones, the folks with critical care, maybe who are over 65, maybe they have a pre-existing condition that sends them to the hospital a lot. There are also Minnesotans who are citizens who are in that situation. And I'm wondering, and some of them have private insurance, the ones who aren't old enough for Medicare. I'm wondering what this bill will do for those folks, the most expensive ones who are citizens, to lower their cost of health care.
Representative Backer.
It'll keep a system alive, because right now what we have is, and I've said this many times, we have probably the best health care, or one of the best health cares here in Minnesota. Great hospitals, EMS, pharmacists, and so forth. And if that system collapses, which has the potential, we saw that California, Illinois recognized that potential collapse. We are on the same path. What we're doing is we're being responsible and saying, whoa, we want to ensure that seniors, Minnesotans, law-abiding Minnesotans, and children, and those families continue to get the best health care that we have. There's a lot of work we have to do. We still have work to do. But putting more people in the mix, without prioritizing Minnesotans is not the right thing. So those individuals would lose health care. We would see more hospital deserts potentially. Definitely we would. We would see more pharmacies, dentists. So what we're doing is we're saying, and what Leader Niska was saying, I think I can say for him, is we have to make sure that Minnesotans that we have right now are receiving the health care that they expect, law-abiding, hardworking Minnesotans, and that's what we're doing, folks.
Representative Greenman.
Thank you, Madam Speaker. I'm not going to ask any more questions because the answer is clear. This bill does nothing to lower the costs for Minnesotans who are struggling with health insurance. You talked about how we save the system. The biggest threat to our system is the Trump MAGA big terrible bill that is going to cut hundreds of millions of, maybe hundreds of millions, maybe billions, out of our health insurance system, and is going to mean that Minnesotans, citizens that you seem to prioritize, are going to lose health care. And the private market that you all have said exists for everyone in this humane way is not filling the void. Here's the deal. This bill doesn't do what Minnesotans are asking us to do. It does nothing to stop the insurance companies who have denied care, who have increased the salaries of CEOs while depriving Minnesotans of all stripes, of all ages, out of care. It does nothing to stop the health insurance companies who are increasingly being taken over by private equity, that are closing rural hospitals, that are shedding beds. You know, for people who get pregnant in rural Minnesota, you now have to drive hundreds of miles because that just wasn't profitable enough for these companies. This system doesn't work. And what you all are doing, what this bill does, is it scapegoats 22,000 Minnesotans and doesn't even save the state money. It costs us more. It doesn't do anything for those Minnesotans that you are hearing from, that I am hearing from, about lowering the cost of health care. So let's not pretend that you're helping Minnesotans with legal status by hurting the 22,000 Minnesotans without it. We are hurting Minnesotans. And we have hurt Minnesotans by not actually dealing with that issue of the high cost of health care and the insurance companies, the CEOs, the big pharma. We all know it. It'll show up on all of our lit. But this bill, and we heard Representative Backer say 3 times a bunch of words about tax, blah, 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 blah. But he literally said nothing about what this bill will do to help Minnesotans. So don't pit Minnesotans of legal status against Minnesotans without, when what you're doing is trying to distract from the fact that CEOs, that health insurance companies, that big pharma are bilking billions and millions of dollars out of our taxpayer dollars, as well as out of the pockets of Minnesotans. So that's the issue we should be working on. That's the issue this bill should be, but we can't do that because we have 67, and you all won't do that with us. So Minnesota members, this is an easy vote no. It's a moral vote no. But also, if you just care about listening to your constituents and them being able to pay their hospital bills, them being able to pay their pharmaceutical bills, this bill doesn't do that either. So members, vote no.
I know a lot's already been said today, so I'm going to try to keep what I'm going to say short. And before I start, I want to just say that I'm not going to stand here and impugn the motives of Republicans. To be honest, I think that I'm friends with many of you across the aisle. I've sang karaoke with Representative Heinzman's daughter, and we did win $50 at this event, and I think we split it, so it's under the minimum of maybe what I can receive. You know, I've had Representative Gilman defend me at events in which someone said something very racist about people who speak other languages, and she defended me. And Representative Ingen played baseball with me when I was going to throw out the first pitch at the Saints game a couple weeks ago. So, this is not about impugning anybody's motives, but I would like for you to put a face to the name, face to what it is that we are doing here today, because I think that sometimes it's easy for us to other people. We don't know who they are. And, I came about this information really in a roundabout way. So I missed caucus last night because we were doing end-of-life planning for my father. And I hadn't told my caucus, and I've been spending a lot of time with my father, who brought us all to this country at the end of the Vietnam War. And I asked my father about how we came to the United States. And I always thought that we came here because my grandfather was a colonel in the Secret War. And I thought that meant that we were in line to come to the U.S. And my father told me that was not true, even though my parents both worked for a Christian organization. And my father actually worked at the U.S. consulate because he was one of the few people who could speak English, and he could type really fast, and apparently that was a very valued skill then. So they had my father move away from the refugee camp from my mom and my sisters and I, and he went to live at the consulate where he processed all of the paperwork for the refugees that came to America. And we had missed our time to come to the U.S. 3 times, and if we didn't come that last time, we would not have been able to come to the U.S. And I said, wow, what luck of ours. And my mom said it wasn't luck. We did not have our names on that list to come to the U.S. because even though your grandfather worked for the CIA, and because there was no, if you were a child of somebody worked for the CIA, the only people that had names to come to the U.S. were if you were in the direct military and you worked for the CIA or you worked for USAID. And which is why it's so personal to me that USAID is getting unfunded, but we did not do either one of those. My parents' Christian organization did not count. And so what my father did was one of our uncles worked for USAID, and because his mother had died, my father, as the one processing the paperwork, put my grandmother down as his mother. And so I am illegal in this country. My parents are illegal here in this country. And when we were fleeing that situation, never one time did my family say, let's look at which state has the greatest welfare and which state has the greatest benefits, because that's the state we're going to go to. Nobody leaves their country unless they have to leave that country. And that I asked my parents, were you scared coming to America? And I record all this because I can't believe that I'm going to be turning 52. I never asked my parents these stories before. And my mom said, we weren't scared. Because America, we knew, was the land of opportunity, and that if we worked hard, we could become something. And she said, and I said, well, did you ever miss Laos? Well, we couldn't go back for many decades. And the first time my parents went back was in 1989, and then we weren't allowed yet to go back into Laos. And so my parents, because they went back because my father was really ill, and they went back to try to do some natural healing because they told my father that he wasn't going to live past that cancer. And so she said they sat on the side of Thailand and looked across the Mekong River into Laos. And they cried because they missed their homeland so much that even in a country where you have all of these benefits and all of these privileges and all the opportunities, that you never want to leave your country. And I tell you this story because I want you to think about who it is that you are calling illegal. My family was just smarter in how we illegally came here. We had more privileges and more ability, which is why we came here in that way. Representative Schultz says that those who broke the law to come here. When you think about those things, people think about me. My family broke the law to come here. I never knew that. I just learned that now. So when you're thinking about voting no on this bill, you're voting no against someone like me who has paid more into this country than it has ever given to me. That the blood of my grandfather who died for democracy, that he never received benefits being in this country, and yet he paid taxes his entire life into it. That my parents who have worked as entrepreneurs and small business owners and people who have paid into a system, that right now my father is refusing to get the surgery that could save his life because he's afraid of the cost and the burden that might leave my mother. That we are the people that you are calling illegal, the people who are coming here in ways that we broke the law to get here, when we're calling people who are undeserving. I am that person. My parents are those people. And this country will never be able to pay back what my parents did because they raised 4 engineers and 2 daughters in finance. And that we have paid more into taxes, we've given more to this community, more in philanthropy, more in what we've done, that this country will ever give back to us. I'm asking you just to give everyone else the same opportunity that my family had. That however they got here, they didn't want to leave where they were. And Representative Schultz, we are not looking to what state is going to give us the best benefits. We are looking to just be alive. That is what we are doing. And so please, when you press that button today, I hope that you choose yes, because you're choosing yes for someone like me, like my parents. Thank you.
I rise today in opposition of this bill, like many of my colleagues. We've already, learned today, or it's already been established that this bill is not brought forward by large community concern, people bursting through with emails about how terrible it is that their neighbor gets health care finally. We haven't been getting those messages. This bill was born from a lie, from several lies, that people who are different deserve other, less, or nothing. We know that it is a fact that residents of Minnesota, regardless of immigration status, who are working, are paying taxes. Those of us who are citizens, who are here legally, also pay taxes, but there's a difference. We have access to the systems that we are paying for. There is a whole host of people who are also contributing to our own health care that will not have access to the same health care. So now we're saying, not only do we not want you here in the first place, but when you come here and you try to provide for your family, guess what? You're going to provide for my family too, and you're not going to get any access to the stuff we get. You're just going to help pay for my health care. I have not run into a single constituent who has said, my neighbor of a different immigration status is a drain on my family. I don't know where this narrative has come from. I've seen it on the federal level, and we know why that is. But here in Minnesota, where we've had waves of different groups from different places for generations, starting with groups from Europe and Spain, and people who got on boats and got lost and then decided this place was theirs. What on earth, what kind of message are we sending that says, you know, my family who came here and crashed and declared all of this theirs and then killed a bunch of people who lived here first, now I'm going to protect it. And any new people who try to come on my turf now, well, guess what? Get out or pay for my stuff, but you get nothing. And I hope when we all go and we advocate to come back to this place for another term, if you can give yourself reason enough at the doors to say why you voted for this, I sincerely hope that when people ask what you did for their family, for their immigrant grandfather, and they say, hey, were you one of those guys that took his health care away? Are you going to proudly say yes, like you'll proudly push your button? Are you going to walk up to a house and say, hey, are there any voters home today? Oh, hey, how are you? What can I do to help your family? Oh, I can make sure that your family's taken care of. I got you. I took your grandpa's health care away. Don't even worry about it. I'm not sure what sort of positive response that anyone is looking for. And we all represent, and I hear you chattering, you're mad because of people's status, and you're sitting there eating your chips and laughing at me. At least he's not trying to slap me this time. But look, folks, we all represent people who can't vote for us. And we stand up here proudly on both sides advocating for them every day. And those people are called kids. And we finally found a common ground that kids are kids. And they're not going to be affected by this. Thank God. And I say that as somebody who's not religious. Thank God we are protecting children. But for some reason, their older sibling, their parent, their grandparents, screw them. It was easy for me to get here. I was born here, so I'm just going to enjoy all these benefits because I did nothing to get here. But this family who worked hard and got away from life that was hell, lost some of their family on the way maybe, not really sure where the rest of their family is. Oh, you know what though? You forgot to fill out some paperwork. That's really hard to get and really expensive and takes a really long time to get in the first place. So you probably would have been dead from whatever you were running from before you got here. I don't know what this is for other than to be cruel. And I hope that when you go out and you say, please vote for me again, that you are honest in saying, I took away health care from your neighbors. You know your kid's best friend at school? Yeah, their mom and dad, I took their health care away too. And guess what? While I was at it, I made sure people couldn't sign up anymore. I hope that you proudly say that to people and have real good reasons to say, you know what? No, they don't get what we get, but they can pay for what I get. This is absurd. Vote no.